This is Chapter 12, Principles of Pharmacology. Your National EMS Education Standard Competencies applies to patient assessment and management fundamental knowledge of the medications carried by the advanced EMTs that may be administered to a patient during an emergency. We are going to talk about the principles of pharmacology, medication safety, kinds of medication used during an emergency, medication legislation, the naming procedures, classifications, storage and security, autonomic pharmacology, metabolism and excretion, mechanism of action, the medication response relationships, medication interactions, and toxicity. Administering medications is a serious business. Used appropriately, medications may alleviate pain and improve a patient's well-being. Used inappropriately, medications may cause harm and even death. As an advanced EMT, you will administer certain medications to patients, help patients self-administer other medications, ask patients about medication allergies, and report patient information to hospital personnel. Advanced EMTs who do not understand how medications work place themselves and their patient in danger. A drug profile gives all of the specifics about a drug. It's included in the package insert, also listed in various pharmaceutical publications. You should familiarize yourself with the drug profiles of the medications you may be expected to administer. Table 12.1 lists components of a drug profile. The terminology. Pharmacology is the study of the properties or characteristics and effects of drugs and medications on the body. Drugs are chemical agents used in the diagnosis, treatment, and prevention of disease. The term drugs and medications are often used interchangeably. However, drugs may make some people think of illegal substances. You should try to use the word medications, especially when interacting with patients and families. Medication is a chemical substance used to prevent disease or relieve pain. The dose is the amount of the medication that is given, and this depends on the patient's size, patient's age, and whether the patient is an adult or child. Also, the desired action of the medication. An action is a therapeutic effect or intended effect that a medication is expected to have on the body. Unintended effects are effects that are undesirable but pose little risk to the patient. Untoward effects are effects that can be harmful to a patient. Toxicity is a risk that a substance will pose a health hazard to an individual or organism. Indications are therapeutic uses for a particular medication. Contraindications are times when you should not give a patient medication, even if it is usually indicated for that person's condition. A medication is contraindicated when it would harm the patient or have no positive effect on the patient's condition. Medication names. The drugs we use are derived from four principal sources: animals, vegetables, minerals, and synthetic compounds. Animals, insulin is usually prepared from the pancreas of animals, primarily pigs. Vegetable is a plant source. We get that from roots, leaves, flowers, and seeds. Minerals such as calcium, iron, and magnesium. Also synthetic compounds. These are drugs manufactured synthetically, synthetic forms of vitamins, steroids, narcotics, etc. The trade name, a brand name a manufacturer gives to a medication, such as Tylenol or Lasix. They are proper nouns that begin with a capital letter. One drug may have more than one trade name depending on how many companies manufacture it. The generic name is usually the original chemical name of a medication, such as ibuprofen. This usually is suggested by the first manufacturer and approved by the U.S. Food and Drug Administration, or the FDA. Some medications are called by their generic name more often than their trade name, such as nitroglycerin. All medications licensed for use in the United States are listed by their generic names in the United States Pharmacopoeia, or the USP. The chemical name is the precise description of the medication's chemical composition and molecular structure, and the official name is the name assigned to a medication by the USP, which is usually the generic name followed by the letters USP. Examples of these, chemical name would be 9-chloro-11-beta-17-21-trihydroxy-16-beta methylpregno 1,4-diene-3,20-dione 17-21 dipropionate. The generic name for that is beclomethasone dipropionate. A trade name is Vanseril, and the official name would be beclomethasone dipropionate USP. Prescription medications are distributed by pharmacists according to a physician's order. Over-the-counter or OTC medications may be purchased directly without a prescription. Many problems are attributable to prescription medications and may become more common as more drugs become available over the counter. You may also encounter patients who have taken street drugs, such as heroin or cocaine. Street drugs lack purity of over-the-counter or prescribed medications. They are still pharmacologically active and will cause an effect. Sources of drug information. There are numerous references to learn more about a particular drug. The American Medical Association, or AMA, drug evaluations. A physician's desk reference, also known as a PDR. Hospital formulary, that's a local publication that delineates which drugs are used in a particular facility. Drug inserts, these are packaged with medications. It includes information related to preparation, dosage, effects, side effects, and other information. Table 12.2 lists some of the most up-to-date and reliable sources. There are numerous other texts and sources, including on the internet. Advanced EMTs should be familiar with these resources and field references, particularly regarding medications encountered in the pre-hospital setting. U.S. regulation of pharmaceuticals. The manufacture of pharmaceuticals in the U.S. and most other countries is subject to a variety of laws and regulations. It's intended to protect consumers, prohibits manufacturers from making false claims about the benefits of the drug. It requires manufacturers to publish information about side effects and known potential harmful effects of their products. It outlines the standards for drug manufacturers to ensure that drugs produced by different manufacturers are uniform in strength and purity. The drug standards are published in the USP and the National Formulary. Several federal laws have been enacted to protect patients from unsafe substances and unscrupulous manufacturers and distributors. Drug-related legislation. The Pure Food and Drug Act of 1906, this is the first federal drug-related legislation in the U.S. It's aimed at protecting the public from foods, medications, and alcoholic beverages that may be mislabeled, poisonous, or otherwise harmful. The Food, Drug, and Cosmetic Act of 1938, amended in 1952 and 1962, added several new provisions. It required drug makers to label their products, indicating warnings about possible side effects. It authorized the creation of the FDA and mandated that dangerous drugs could be dispensed only with a prescription. The Harrison Narcotic Act of 1914 regulated the import, manufacturing, prescription, and sale of several narcotic drugs and cocaine, opium, and their derivatives. This requires precise record keeping about the dispensing of controlled drugs, required registration of distributors such as pharmacists, and illegal possession or distribution of controlled drugs could result in fines and imprisonment. The Narcotic Control Act of 1956 increased penalties for violation of the Harrison Narcotic Act. It made the possession of heroin illegal and outlawed the acquisition and transportation of marijuana. The Controlled Substance Act of 1970 It's comprehensive legislation dealing with narcotic and non-narcotic drugs that have a potential for abuse. Specifies requirements for registration, procurement, storage, distribution, record keeping for these drugs, and penalties for failure to comply with these requirements. Drugs covered are classified into 5 categories or schedules according to their abuse potential. Schedule 1 drugs have the highest abuse potential and a propensity for severe drug dependence. They are completely outlawed. On rare occasions, under control of the FDA and Drug Enforcement Agency, or DEA, these drugs may be used for research, analysis, and instruction only. Schedule 5 drugs include those with the lowest abuse potential. Table 12.3 lists these schedules, including descriptions and examples in your book. If the state law is more stringent than the federal law, the state law takes precedence. As an advanced EMT, you should be aware of the laws in your state and always follow local protocols. Manufacturing-related regulations. Federal legislation also focuses on guaranteeing standardization of doses. Standardization assures patients when they take a medication with a stated amount of the active ingredient that they will receive that amount of the drug. For a drug to carry a USP label, the amount of active ingredients must be within 95% to 105% of that stated on the label. Government agencies that regulate drugs are the FDA, Food and Drug Administration. They enforce the Food, Drug, and Cosmetic Act. They also determine the safety and efficacy of drugs before they are allowed to enter the U.S. market. The DEA, or Drug Enforcement Administration, formerly the Bureau of Narcotics and Dangerous Drugs, were created by the Federal Controlled Substances Act of 1970, and they are a division of the Justice Department. They are responsible for executing provisions of the Controlled Substances Act, includes registration of physicians who are permitted to dispense controlled substances. The Public Health Service regulates biologic products. Biologic products are medications made from living organisms. This includes antitoxins and vaccines. And the Federal Trade Commission, or the FTC, monitors drugs advertising to ensure that it is not misleading or inappropriate. They make recommendations to the FDA regarding the direct-to-consumer, or DTC, advertisements. It's found that direct-to-consumers advertisements generally benefit consumers, but stated ads should contain a major statement of drug risk along with adequate provisions for more complete risk information. The drug approval process. New drugs are constantly being developed. The commercialization process takes years. The average time for a drug to be developed, tested, and approved is about 9 years. In some cases, manufacturers find out the drug does not work as envisioned or is too dangerous for human consumption. All new drugs must go through animal studies and clinical trials in humans before approval for distribution. Animal studies are designed to learn more about the properties of a drug and to identify tissues and organs that are sensitive to the actions of the drug. Testing in at least 2 animal species is required by law. After successful completion of animal studies, an investigational new drug may enter clinical trials in humans. During clinical trials, you have phase 1, where the new drug is tested in healthy volunteers to compare human data with those in animals. It determines safe doses of the drugs and assesses the medication's safety. During phase 2, this is performed in homogeneous populations of patients, about 50 to 300 patients. In double-blind studies, one group receives the drug and the other group receives a placebo. It's designed to evaluate the efficacy and safety of the drug and establishes which form is the most effective dose. During phase 3, the drug is made available to a larger group of patients. This is several thousand patients. These studies usually last several years. They evaluate the efficacy of the drug and monitor the nature and incidence of side effects. Phase 4, the company developing the drug can apply to the FDA for approval to the market of the drug. It compares the new drug with others on the market and examines the drug's long-term efficacy and cost effectiveness. Drug storage and security of controlled substances. All drug containers or boxes should be carefully guarded against possible theft. This requires the boxes to be locked and secured within the ambulance. Certain precepts should guide the manner in which drugs are secured, stored, distributed, accounted for. Your local protocols will dictate the manner in which drugs are maintained. If controlled substances such as narcotics are administered, the records must be kept separate from other paperwork. The DEA strictly regulates these substances. If drugs are lost or stolen, the supervisor and law enforcement personnel must be notified immediately. All medications should be stored in an environment with a constant temperature if possible. The potency of medications is affected by temperature, light, moisture, shelf life, and exposure to air. If controlled medications are not used before their expiration dates, they must be destroyed. The destruction must be witnessed by 2 employees and documented on the proper forms. Special considerations in drug therapy, pregnant patients. Before you administer medications to a female of childbearing age, ask the patient whether she could possibly be pregnant. In an emergency, the woman's health is the priority. Before administering any drug to a pregnant woman, expected benefits should be considered against the possible risk to the fetus. Prescription and over-the-counter drugs have the potential to harm the fetus or newborn. Teratogenic drugs is a drug that poses a risk to the normal development or health of the unborn fetus. Changes in a pregnant woman's body affect the way drugs are processed and may increase the chance of harm to the fetus. Metabolism of drugs in the liver is decreased during pregnancy. An increased rate of excretion due to the increased cardiac output during pregnancy. The FDA has established a scale with categories A, B, C, D, and X to indicate drugs that have documented problems in animals and/or humans during pregnancy. Category A drugs pose the least risk, while Category X drugs pose the greatest risk. This 5-category system is being replaced by a more detailed system. Medications approved after June 2015 have only the narrative summary. Table 12.4 outlines the pregnancy categories for both classification systems. There are still many drugs with unknown effects during pregnancy. You must be able to quickly evaluate the risk versus benefits of drug administration. If the drug is the only option for saving the woman's life, then that consideration would be paramount. When in doubt, contact medical control for guidance. Pediatric patients. Medications have a much different effect in adults than in children. Young infants have a sharply reduced metabolic capacity. Incomplete development of the gastrointestinal tract slows absorption of oral medications and delays elimination. Some medications may be more potent in infants than in an adult. Children can metabolize some medications much more quickly than adults and may require relatively higher doses or more frequent administration. And products of metabolism in children can vary from those seen in adults, which sometimes results in unexpected responses. In geriatric patients, changes in pharmacokinetics in geriatric patients are comparable to those in young children. Hepatic functions and GI activity slow in older patients, which delays absorption and elimination. Geriatric patients are often taking several medications. The concomitant therapies may interact and modify the effects of each medication. They may have alterations in normal mental status when on multiple medications and may unintentionally overdose on a particular drug or forget to take it. Scope of practice. As an advanced EMT, you are legally, morally, and ethically responsible for each drug you administer. You must have a good foundation of knowledge of over-the-counter and prescription medications that may interact with the drugs that you may give. You must have enough knowledge to obtain a medical history for patients who are unable to communicate. Drug administration must be safe and therapeutically effective. You should always keep a field guide or other medication reference handy to look up unfamiliar medications. Follow the standardized national guidelines listed in Table 12.5 when providing drug therapy. Methods of drug classification. Classifications of drugs are based on the effect drugs will have on a particular part of the body or on a specific condition. Many medications fall into more than one category. Drugs or medications can be classified into three categories: the body system, class of agent, and mechanism of action. The body system, categorized by the system affected by the drug. Understanding which systems are affected by which drugs will help you make the appropriate decisions for patient care. The class of the agent tells how the medication affects the system, and the mechanism of action is the particular action by which the drug created its desired effect on an organism. Nervous system classifications. The nervous system is the body's principal control system. It's composed of the central nervous system and the peripheral nervous system. The central is made up of the brain and spinal cord, and peripheral includes all of the nervous tissues outside of the central nervous system. The peripheral nervous system also contains the autonomic nervous system that controls all automatic or involuntary functions. It is divided into sympathetic and parasympathetic nervous system. The sympathetic nervous system is responsible for the body's response to shock or stress. It is known as the fight or flight division. This response is associated with the release of adrenaline from the adrenal glands. Adrenergic response is caused because special adrenergic nerve fibers ultimately cause the release of the hormones epinephrine and norepinephrine, or adrenaline and noradrenaline. Sympathetic response includes shunting of the blood from the extremities to the vital core organs, dilation of the pupils, and reduction of the digestive system activity. The parasympathetic nervous system relaxes the body and controls the automatic functions during non-stressful times. This is referred to as rest and relax division. Stimulation results in effects opposite of sympathetic nervous system. Examples include heart and respiratory rate decrease, constricting the pupils, and increasing digestive system activity. Sympathetic and parasympathetic divisions work in constant opposition to maintain basic harmony in the body. Each division takes more precedence in the proper circumstances. Hormones released by the sympathetic nervous system stimulations are carried throughout the body where they cause their intended effects by acting on hormone receptors. They stimulate tissues that are not innervated by the sympathetic nerves. They prolong the effects of direct sympathetic stimulation. Adrenergic receptors are located throughout the body, and once stimulated by the appropriate hormone, they cause a response in the target organ. These are generally divided into four types: alpha 1, alpha 2, beta 1, and beta 2. Drugs affecting the sympathetic nervous system, sympathomimetics. These are drugs that produce the same effects on the body system as the hormones of the sympathetic nervous system. Sympatholytics are medications that inhibit the sympathetic nervous system. They are also known as antiadrenergics. Antiadrenergics antagonize or fight against the effects of the sympathetic nervous system. Antagonists are drugs that counteract the action of something else. An agonist is a drug that binds to a receptor and causes a response. Some medications stimulate alpha and beta receptors, whereas others are selective to specific receptors. Beta blockers are used to control blood pressure in some patients and heart rhythm disturbances in others. They work by filling a portion of the beta receptor sites that beta stimulators would normally bind to. In the pre-hospital setting, you will often administer drugs that agonize the beta 1 receptors in an attempt to treat cardiac arrest and hypotension. Beta 2 selective drugs cause bronchodilation with little effect on the heart, which only has beta 1 receptor sites. Drugs affecting the parasympathetic nervous system. Parasympathomimetics. These are agonists to the parasympathetic nervous system, also called cholinergic medications because they stimulate the cholinergic receptors to which acetylcholine or ACH normally binds. Cholinergic medications may act directly or indirectly on cholinergic receptors. Anticholinergic drugs act to prevent activation of the receptor by binding. When a drug interacts with acetylcholinesterase or ACHE, deactivation of ACH does not occur. If excessive cholinergics are present, the patient may exhibit the sludge M symptoms. Those are salivation and sweating, lacrimation, urination, defecation, drooling, diarrhea, gastrointestinal upset and cramps, emesis, and muscle twitching or miosis. Patients exposed to certain fertilizers, insecticides, VX, which is a nerve agent, and sarin gas exhibit sludge M symptoms. The parasympatholytics are antagonists to the parasympathetic nervous system. Atropine is one of the most commonly used parasympatholytics and is also called anticholinergic medications because they block two types of cholinergic receptors, muscarinic and nicotinic. Muscarinic cholinergic antagonists block ACH exclusively at the muscarinic receptors. An example of that is atropine. Analgesics and antagonists. Analgesics are medications that relieve pain and induce analgesia, which is the absence of the sensation of pain. Opioid agonists. This is the most common class of medications used for analgesia in the pre-hospital setting. It is similar to or derived from the opium plant. They bind opiate receptors, which prevent neurons from sending pain signals. They are CNS depressants. Fentanyl or Sublimase is a popular opioid agonist because it is rapid acting, very potent, and has a relatively short duration of action. Non-opioid agonists, many are available as over-the-counter drugs. Many have antipyretic properties as well, meaning they can reduce a patient's fever. All of them alter the production of prostaglandins and cyclooxygenase, or COX, to produce their effects. Three forms are particularly popular. Salicylates, which is an example of that, is aspirin. Aspirin targets the COX-1 enzymes to reduce platelet aggregation and provides great benefits in patients who are suspected of having a myocardial infarction. Non-steroidal anti-inflammatory drugs, or NSAIDs. Example of this is ibuprofen. It's designed to reduce pain, inflammation, and fever. Works by inhibiting the COX enzymes, which produce the chemical prostaglandin and promotes pain, inflammation, and fever. A para-aminophenol derivative. An example of that is acetaminophen or Tylenol. Opioid antagonists reverse the effects of opioid drugs. They bind with the opiate receptors in an antagonistic manner. As a result of this binding, the opioid molecules cannot get to the receptor and the receptor cannot initiate its action. Naloxone or Narcan is the most common in the pre-hospital setting. Opioid agonist antagonists. These have agonistic and antagonistic properties. They often referred or preferred because they can decrease pain but not diminish function of the respiratory system or lead to dependence or addiction. Anti-anxiety, sedative, and hypnotic drugs. These drugs are used to help a patient sleep through a medical procedure by producing sedation and hypnosis. Drugs that create sedation and hypnosis include benzodiazepines, which are sedatives most commonly used to prepare patients for invasive procedures. The exact mechanism of action is not fully understood. It is believed to affect the neurotransmitter gamma aminobutyric acid, or GABA, GABA. in the brain. Barbiturates are believed to work very similarly to benzodiazepines by increasing the affinity between receptor sites and the neurotransmitter GABA. Non-barbiturates, hypnotics, have identical properties to benzodiazepines and barbiturates in how they affect the GABA receptors. However, they tend to have comparatively few side effects, particularly in terms of cardiovascular compromise. Anticonvulsants. A seizure is a state of neurologic hyperactivity. Active seizures generally require treatment in the pre-hospital setting due to associated complications. Anticonvulsant medications. The exact mechanism behind them is not completely clear. They are believed to work by inhibiting the influx of sodium into cells. They decrease the cell's ability to depolarize and propagate the seizure. Several other types of drugs are used as anticonvulsants, including benzodiazepines, barbiturates, hydantoins, and valproic acids. Stimulants is a common group of CNS agents. They exert their action of excitation of the central nervous system. Stimulation of the central nervous system can be accomplished by increasing excitatory neurotransmitters or decreasing inhibitory neurotransmitters. Examples include caffeine, cocaine, prescription, and illicit amphetamines. They increase the release of dopamine and norepinephrine to increase wakefulness and awareness and reduce drowsiness and fatigue. They increase tachycardia and hypertension. They can cause seizures and psychosis. High doses can cause increased nervousness, irritability, tremors, and headache. Some people experience withdrawal symptoms when they stop taking stimulants. Depressants, central nervous system agents that slow brain activity. They may be prescribed to treat anxiety, muscle tension, pain, insomnia, stress, panic attacks, or seizures. Some central nervous system depressants are used as anesthetics. Examples include lorazepam, which is Ativan, diazepam, which is Valium, alprazolam, which is Xanax, and zolpidem tartrate, which is Ambien. Psychotherapeutic drugs work by blocking dopamine receptors in the brain. They are used to treat illnesses such as schizophrenia and depression. They are associated with a host of side effects. Extrapyramidal symptoms include involuntary movements, tremors, rigidity, muscle contractions, restlessness, and changes in breathing and the heart rate, orthostatic hypotension, sedation, and sexual dysfunction. Depression is often treated with selective serotonin reuptake inhibitors, or SSRIs, monoamine oxidase inhibitors, MAOIs. SSRIs and MAOIs block the metabolism of monoamines in the brain. Tricyclic antidepressants, or TCAs, are still occasionally used, but their popularity is waning. Drugs affecting the cardiovascular system. The walls of the heart are composed of many interconnected cells specialized to serve particular functions. Medications targeting the cardiovascular system are classified according to their effects on specialized cells. Effects on the heart are categorized as following: chronotropic, which affects the heart rate; inotropic, which changes the force of contraction; and dromotropic, which affects the velocity of the conduction of electricity through the heart. All three effects can be positive or negative. Cardiac glycosides. This is a class of medications derived from plants. They block certain ionic pumps in the heart cell's membranes, which indirectly increase calcium concentrations. This is associated with numerous side effects. Antiarrhythmic medications. They are long used in the pre-hospital setting to treat and prevent cardiac rhythm disorders. They can have direct and indirect effects on cardiac tissue. They are classified into groups according to their fundamental mode of action on the heart. Sodium channel blockers slow conduction through the heart and have a negative dromotropic effect. Beta blockers reduce adrenergic stimulation of beta receptors. Potassium channel blockers increase the heart's contractibility, which is a positive inotropic effect. Calcium channel blockers decrease the force of contraction and automaticity. It decreases conduction velocity, which is a negative dromotropic effect. Antihypertensive medications. These are used to treat hypertension. The treatment goals are to keep blood pressure within normal limits, maintain or improve blood flow, and to reduce stress placed on the heart. Diuretic medications. They cause kidneys to remove excess amounts of salt and water in the body. They reduce the level of stress placed on the cardiovascular system by lowering the total fluid volume. They lower the preload on the heart and decrease the stroke volume. Vasodilator medications act on the smooth muscles of the arterioles and veins. This explains why nitroglycerin is so beneficial in treating myocardial ischemia. However, dilation of these vessels prompts a response from the sympathetic nervous system. When vasodilators are used to lower blood pressure, the patient must also take medications that inhibit the sympathetic nervous system. Sympathetic blocking agents include beta blockers and adrenergic inhibitors. Beta blockers compete with epinephrine to bind with available receptor sites. This diminishes the effects of beta stimulation. Angiotensin converting enzyme, or ACE inhibitors. They target the renin-angiotensin-aldosterone system. They suppress the conversion of angiotensin 1 to angiotensin 2. Angiotensin II is a potent vasoconstrictor that promotes smooth muscle contraction in the arterioles throughout the body. Constriction raises blood pressure by increasing peripheral resistance. Calcium channel blockers also have anti-dysrhythmic and antihypertensive properties. Anticoagulants, fibrinolytics, and blood components. Platelets repair damage in the blood vessels. Defects in blood vessels can cause blood flow to slow. If blood flow slows significantly, a blood clot or thrombus forms. Abnormal thrombus may cause a life-threatening crisis such as a stroke. A variety of medications are used to prevent or minimize the detrimental effects of the thrombus. Antiplatelet agents interfere with the aggregation or collection of platelets. They do not break down aggregated platelets. They prevent further buildup of these blood cells. Salicylic acid has significant antiplatelet properties. It is important in the pre-hospital setting. It minimizes damage to the myocardium in acute coronary syndrome. Anticoagulant drugs work against coagulation to prevent the formation of a thrombus. Some patients can be prescribed these on a long-term basis as a preventative measure. You need to be aware of anticoagulant use, particularly when patients have sustained a traumatic injury. This can prevent life-saving coagulation needed to prevent blood loss. Fibrinolytic agents may be administered to dissolve the thrombus and prevent it from breaking off and entering the bloodstream. It promotes digestion of fibrin. The protein involved in forming a blood clot. It's used in the pre-hospital setting. Its use remains controversial. In some circumstances, other forms of reperfusion therapy may be indicated. Drugs affecting the respiratory system. Oxygen is the most commonly used medication in the pre-hospital setting. It has appropriate and inappropriate uses and some side effects. Use of over-the-counter decongestant medications is common, especially during cold and flu seasons. Each decongestant varies slightly in terms of mechanism of action, and all medications seek to reduce tissue edema, facilitate drainage, and maintain the patency of the sinuses. Patients may take antihistamines during allergy season. Try to find out which medications your patient is taking. Know the effects that these drugs may have on other medications. Know the signs and symptoms they can produce. People have been known to overdose on pseudoephedrine, which is a decongestant, dextromethorphan, which is an antitussive, that's a cough medicine, and diphenhydramine, which is an antihistamine. Severe respiratory emergencies can often arise from severe narrowing of any portion of the respiratory tract. Respiratory tract is lined with smooth muscle fibers that influence the diameter of the airway. Control of the smooth muscles is maintained by the autonomic nervous system. Many respiratory emergency treatments attempt to expand the respiratory tract by using sympathomimetic medications. Complications arise when patients with respiratory emergencies eventually experience decreased amounts of oxygen to vital organs. Increased heart rate and greater force of contraction lead to a higher demand for oxygen, which is already in short supply in a respiratory emergency. Stimulation of the beta-2 receptors is most beneficial to patients with respiratory emergencies. These drugs produce smaller increases in heart rate and forced contraction. They dramatically decrease the body's rate of oxygen consumption. Xanthines are second-line treatment in a respiratory emergency. They relieve airway constriction by relaxing the smooth muscle of the bronchioles, stimulating cardiac muscles to work harder, and increasing blood flow. They stimulate the central nervous system. Caffeine is a well-known xanthine and CNS stimulant. Other respiratory medications suppress the inflammatory response that typically causes acute distress for patients with restrictive airway diseases. In the acute care setting, corticosteroids can be administered for this purpose. Drugs affecting the pancreas. A variety of hypoglycemic medications are available. Others may not act on the pancreas directly, but may alter the way insulin is used in the body. In the absence of pancreatic function, patients may take insulin injections. Sulfonylureas increase insulin secretion from the pancreatic beta cells. These are effective only if patients have residual beta cell function. Insulin sensitivity is increased by oral hypoglycemic agents. Drugs affecting the immunologic system. Immunosuppressant medications are often prescribed to patients who undergo an organ transplant or have an autoimmune disease. Immunosuppressants are intended to inhibit the body's ability to attack the foreign organ in an organ transplant or inhibit the body's attack on itself for autoimmune diseases. This is generally derived from fungus or bacteria. They tend to have a complicated mechanism of action, and essentially they inhibit lymphocytes and T cells from carrying out their immune functions. Vitamins and minerals. These are necessary substances that allow for normal metabolism, growth and development, and cellular function. Patients may be taking vitamin and mineral supplements. They try to replace deficiencies and are used as a preventative measure. Thiamine is an important medication in the pre-hospital setting. It aids in converting carbohydrates into energy. People with alcoholism, among others, tend to be deficient in this vitamin. Fluids and electrolytes. A crystalloid solution is typically used in the pre-hospital setting. It can be isotonic and provide a stable medium for the administration of medication or provide effective fluid and electrolyte replacement. Hypertonic helps to provide nutrition, and hypotonic is beneficial in dehydration situations, not hypovolemic cases. You may also administer colloid solutions to your patients. Drug forms. The form that a medication comes in usually dictates its route of administration. The manufacturer chooses the form to ensure proper route for the medication, timing of its release into the bloodstream, and effects on the target organs or body systems. Solid drugs. Most medications that are given by mouth to adult patients are in tablet or capsule form. Capsules are gelatin shells filled with powder or liquid medication. If the capsule contains liquid, the shell is sealed and soft. If the capsule contains powder, the shell can usually be pulled apart. Tablets often contain other materials that are mixed with the medication and compressed under high pressure. Some are designed to dissolve very quickly in small amounts of liquid. They can be taken sublingually and absorbed rapidly. Sublingual nitroglycerin is an example. They are especially useful in emergency situations. They may be ground into powder to be absorbed more quickly. Generally, medications that must be swallowed are less useful in an emergency. The digestive tract provides a slower route of delivery. Pills are solid drugs that are shaped into a ball or oval to be swallowed and are often coated to disguise an unpleasant taste. Suppositories are administered by inserting them into the rectum. It is more rapidly absorbed than medications that must travel through the upper portion of the digestive tract. These are not administered by advanced EMTs. Liquid drugs. Solutions are a liquid mixture of one or more substances that cannot be separated by filtering or allowing the mixture to stand. It can be given by any route. When given by mouth, it can be absorbed by the stomach fairly quickly because the medication is already dissolved. Solutions that irritate the stomach can be applied topically to the skin, sprayed sublingually, or inhaled. Many solutions can be given as an IV medication. Solutions can also be delivered via injection through intramuscular, IM, or sub-Q-SC. You may need to assist a patient with sublingual delivery of nitroglycerin or IM delivery of epinephrine in a case such as allergic reaction. Suspensions. Most substances do not dissolve well in liquids. Some can be ground into fine particles and evenly distributed throughout a liquid by shaking or stirring. Example is activated charcoal. This is used in patients who have overdosed or ingested certain poisons. You may encounter several types of liquid drugs that include alcohol in their preparation. Tinctures, and they are named for the material contained in the tincture other than alcohol, and is added to the name of the tincture. Spirits are alcohol solutions that are volatile. Elixirs are one of the most common types of medicinal preparations. They are taken orally as a liquid. They are made up of a sweetened, aromatic, hydroalcoholic liquid. Syrups are mixtures with a high sugar content. They are designed to disguise the taste of medication and most commonly used for children's medications. Emulsions are a mixture of two liquids that are not mutually soluble, generally a mixture of water and oil that must be thoroughly shaken to mix. Metered dose inhalers. If liquids or solids are broken into small enough droplets or particles, they can be inhaled. A metered dose inhaler is a miniature spray canister used to direct such substances through the mouth and into the lungs. This delivers the same amount of medication each time it is used. It must be shaken vigorously before the medication is administered because the inhaled medication is usually a suspension. This is commonly used by patients with respiratory illness such as asthma and emphysema. Topical medications are applied to the surface of the skin. They affect only the area of application. Lotions contain the largest amount of water of all topical medications. They absorb the quickest of the topical medications. An example of this is calamine lotion. Creams are absorbed more slowly than lotions but faster than ointments. An example would be hydrocortisone cream used to diminish skin itching. Ointments contain the smallest amount of water. They have a slow rate of absorption. An example is Neosporin. Transcutaneous medications, also known as transdermal, are designed to be absorbed through the skin transcutaneously. They can affect other areas of the body. Common examples include nitroglycerin for chest pain and fentanyl for pain management. In contrast to most topical medications, transcutaneous medications are usually intended for systemic effects. Gels are a semi-liquid substance administered orally through capsules or plastic tubes. They usually have the consistency of paste or creams but are transparent. An advanced EMT may give oral glucose in gel form to a patient with a low blood glucose level. Gases are neither solid nor liquid, most often delivered in an operating room. Oxygen is the most commonly used medication in gas form in the pre-hospital setting. In concentrated form, it is a potent medication with systemic effects, usually administered through a non-rebreathing mask or a BVM. Nitrous oxide is an analgesic. It may be administered by advanced EMTs to reduce pain, administered by inhalation through a mask, and has euphoric effects. Routes of drug administration. The route of the drug administration affects the rate at which the onset of action occurs and may affect the therapeutic response that results. The choice of the route of administration is crucial in determining the suitability of a drug. Drugs are given for their local and systemic effects. Absorption is the process by which medications travel through the body tissues until they reach the bloodstream. Enteral drugs are administered along any portion of the GI tract. Oral, or PO, means taken by mouth. It enters the bloodstream through the digestive tract and can take as long as 1 hour for absorption to occur. Rectal, or per rectum, PR, no advanced EMT medications are administered rectally. A possible exception would be D50 if allowed by local protocols. Parenteral drugs are administered through any route other than the GI tract. This is IV injection into the vein. For medications that need to enter the bloodstream immediately, it's the fastest delivery but cannot be used for all medications. Intraosseous, or IO, is into the bone. It reaches the bloodstream through the bone marrow. It requires drilling a needle into the bone cortex. It is painful, often reserved for patients who are unresponsive as a result of cardiac arrest or extreme shock. Most commonly used for children who have less available or difficult to access IV sites. Subcutaneous injection. This is beneath the skin. The injection is given into the tissue between the skin and the muscle. They generally absorb more slowly and have longer lasting effects. It is a useful way to deliver medications that cannot be taken by mouth as long as they do not irritate or damage tissue. Examples would be daily insulin injections and some forms of epinephrine. It is not appropriate for patients with decreased peripheral perfusion. Intramuscular, or IM injection, is into the muscle. It's usually absorbed quickly because muscles are highly vascular. Some types of medications are designed for a slower, sustained release from the muscle. Many have the prefix depot, meaning they form a deposit in the muscle after being injected. Possible problems are damage to the muscle tissue, uneven and unreliable absorption, especially in people who are experiencing decreased peripheral perfusion, as in shock. Sublingual, SL, is under the tongue. It is absorbed by the venous plexus under the tongue, enters the bloodstream through the oral mucous membranes within minutes. It's faster than the oral route and protects medications from chemicals in the digestive system. An example would be nitroglycerin. Buccal is similar to the sublingual route. Medication is placed between the cheek and the gums where it is absorbed by the bloodstream, and that's a common route for glucose gel. Transcutaneous, or transdermal, absorbed through the layers of the skin. Some medications can be absorbed transcutaneously. Example would be nicotine. Or medications that come in another form is administered transcutaneously to achieve a slower, longer lasting effect. Example would be an adhesive patch containing nitroglycerin. Intranasal is IN, relatively new format for the delivery of medication. Medication is pushed through a specialized atomizer device called a mucosal atomizer device, or MAD. Liquid medication is turned into a spray and is administered into a nostril. It's quick absorption due to high blood flow in the head and face. An example for that is naloxone or Narcan. Inhalation, drugs are aerosolized and drawn into the lungs through the mouth or nose as the patient breathes. A nebulized medication or a metered-dose inhaler. Some medications are inhaled into the lungs so they can be absorbed into the blood more quickly. Others are inhaled because they work in the lungs. Generally, inhalation helps minimize the effects of the medication on other body tissues. It comes in forms as aerosols, fine powders, and sprays. Table 12.7 in your book lists common routes of medication administration and the rates for absorption, so make sure you pay attention to that. Pharmacokinetics, movement of drugs through the body. Pharmaceutical properties determine a drug's concentration at its site of action. Drugs modify existing functions of tissues and organs. They do not give new functions to tissues or organs. In general, drugs cause multiple actions rather than a single effect. A drug action is the result of a physiochemical interaction between the drug and a molecule in the body, such as a receptor. Pharmacokinetics. Once administered, drugs go through 4 stages: absorption, distribution, metabolism, and excretion. Pharmacokinetics is the study of these 4 stages and the metabolism and action of drugs. The principles of pharmacokinetics. Carefully consider the pharmacokinetic properties of any medication you are thinking of administering to a patient. As a medication is administered, the body begins a complex process of moving the medication. The medication dose, route of administration, and clinical status of a patient will largely determine the duration and effectiveness of the medication. The pharmacokinetic section of medication profiles typically states the onset of action, peak, and duration of action for most medications. The onset and peak of a medication are generally related to absorption and distribution. A minimum dose or concentration of medication must be present at certain sites in the body for clinical effects to occur. The duration of action is generally related to medication metabolism and elimination. Drug absorption. Absorption is the passage of a substance through some surface of the body into body fluids and tissues. It has numerous variables that affect the absorption rate: the nature of the absorbing surface, blood flow to the site of administration, solubility of the drug, pH, drug concentration, dosage form, route of administration, bioavailability, diffusion, osmosis, and filtration. Drug distribution. Drugs pass freely and quickly out of the vascular space and into the interstitial fluid. Blood flow to the area determines the amount of a drug reaching a particular part of the body. Some areas of the body, such as the brain and placenta, are less accessible to certain drugs than others. Biotransformation. Many drugs are inactive when administered and only become active once they have been absorbed and converted into an active form in the blood or by the target tissue. Biotransformation is the chemical alteration that a substance undergoes in the body. The primary organ for biotransformation is the liver. If the liver is diseased, inactivation or detoxification of drugs may be impaired. The liver performs synthetic reactions that yield inactive products or metabolites that can be secreted by the kidneys and non-synthetic reactions. Drug elimination. Excretion is the elimination of waste products from the body. Drugs are eliminated in their original forms or as metabolites. The organs of excretion include kidneys through urine, intestines through feces, lungs through respiration, salivary glands through sweat, mammary glands through breast milk. Rates of elimination vary with the amount of the drug in the body and the underlying condition of the excretion organs. A patient's poor ability to eliminate a drug may lead to an accumulation of the drug if subsequent doses are given, resulting in toxic effects. Consider this especially for patients in shock and for geriatric patients. Pharmacodynamics is the way in which a medication produces the response we intended. This is also known as the mechanism of action. It includes factors that may alter the intended response and any side effects or unexpected effects. Mechanism of action. To produce optimal desired or therapeutic effects, a drug must reach appropriate concentrations at its site of action. Molecules of the chemical compound must proceed from the point of entry into the body to the tissues with which they react. Magnitude of the response depends on dose and time it takes for the drug to travel in the body. Drugs may produce effects locally, systemically, or both. Local effects result from the direct application of a drug to the tissue. Systemic effects occur after the drug is absorbed by any route and distributed into the bloodstream. It almost always involves more than one organ, but the response of one or another organ may predominate. Medications cause their action on the body by four mechanisms. They may bind to a receptor site. They may change the physical properties of a cell. They may chemically combine with other chemicals, or they may alter a normal metabolic pathway. Medications that bind to a receptor site are the most prevalent, particularly in the pre-hospital setting. The cellular response can be wide-ranging depending on the chemical mediator and the cells being stimulated. Mediation molecules must compete with naturally occurring chemical mediators and potentially other medications. Once the medication is bound to the receptor site, it initiates a chemical change that produces the expected effect. Sometimes this chemical change is the intended effect. In other cases, the initial change releases a second compound or a second messenger that causes the unintended effect. Drug-response relationship. Once the medication finds the target tissue, it needs to accumulate to a sufficient concentration to produce its desired effect. The drug-response relationship correlates the amount of medication given and the response it causes. When administering a medication, you need to know the onset of action, duration of action, and termination of action, the amount of time after the concentration level falls below the minimum level to the time it is eliminated from the body. Onset, duration, and termination of action effects the therapeutic index, the ratio of the drug's lethal dose for 50% of the population, or LD50, to its effective dose for 50% of the population, which is the ED50. It gives an indication of a medication's margin of safety. Each medication also has a biologic half-life, which is the time it takes the body to eliminate half of the drug. A therapeutic threshold is the minimum concentration required to produce the desired response. A concentration lower than the therapeutic threshold will not induce a chemical response. A concentration higher than the therapeutic threshold can be detrimental and possibly fatal. The goal of drug therapy is to give the minimum concentration of a drug that will produce the desired effects. Table 12.9 in your book lists the factors that alter drug responses. Factors influencing medication interactions. There are many variables that influence medical interactions. It is important to know how medications affect the patient and other medications that were previously administered. An interaction between medications occurs whenever the actions of a drug on the body are modified by another chemical substance. This could be another prescription medication, herbal or over-the-counter medication, nicotine from cigarette smoking, something in the diet, or anything to which the patient is exposed. It is important to be aware of the potential interactions of medications that are prescribed and those that the patient may be administering. Many patients, especially elderly patients, may take several medications each day. This is known as polypharmacy. The chance of developing an undesired medical interaction increases rapidly with the number of medications used. Patients may also take medications that interact with other substances, such as food or alcohol. Warning labels on prescription bottles indicate substances that may cause interactions. Predictable responses. Because the extensive research that goes into developing and testing a medication, there is common knowledge about what a drug will do to a patient. You should anticipate responses beyond the desired effect. Side effects are any action of a medication other than the desired actions and may occur even when a medication is administered properly and under the appropriate circumstances. Iatrogenic responses. Adverse conditions inadvertently induced in a patient by the treatment given. An example is a urinary tract infection that develops in the patient after the insertion of an indwelling catheter. This results when the administration of medications lead to symptoms that mimic naturally occurring disease states. Unpredictable responses. Some patients may have adverse effects that are not anticipated. Most common unpredictable response encountered in the pre-hospital setting is an allergic reaction. An allergy develops when a person has previously been exposed to a particular antigen and develops antibodies against that substance, or sensitization. After a person has become sensitized, subsequent exposure to that same substance results in hypersensitivity. Because the patient is hypersensitive, the drug activates the immune system. This may lead to anaphylaxis or an acute systemic reaction that is usually life-threatening. Allergic reactions can be immediate or delayed. Before administering a medication, question the patient about any known drug allergies. Remain alert for an allergic reaction after administering any drug. Serum sickness is a delayed reaction, hypersensitivity similar to an allergic reaction. It occurs a considerable time after a stimulus. It can develop as late as 7 to 14 days after the first exposure to a medication. Idiosyncrasy. Patients experience a completely unique response specific to that person and not seen in other patients. Idiosyncratic reactions are peculiar and individual reactions to a drug. Tolerance is when a patient who takes a particular medication for an extended period of time may build up a tolerance to it. Patients will have decreased response to the same amount of the medication, often requiring higher dosages than normal. Cross-tolerance is a tolerance to other drugs in a certain class as a result of prolonged administration of another medication in the same class. This is often seen in patients who take pain medications. A disease or condition that does not respond to treatment is called refractory. Any medication needs to reach a minimum concentration in the target tissue before it becomes effective. That concentration is reached by providing a specific dose. And if several doses are given in a relatively short time, the patient may experience a cumulative effect. The increased effect when a medication is given in several successive doses, which might result in therapeutic or non-therapeutic effects. Drug dependence occurs with prolonged administration of a medication. Psychological and sometimes physical state resulting from continued use of a substance. Patients can experience a compulsion to take the drug on a continuous or periodic basis to experience its effects or avoid the discomfort of its absence. A person will have significant symptoms if he or she stops using the medication. Habituation is a physical tolerance and psychological dependence on a drug or drugs. Drug interaction. Many patients take multiple medications at one time. Drug interaction occurs when the effects of one medication alter the response of another medication. This can be fatal. Interaction may not always be anticipated. It's possible to see the opposite or a completely unrelated response. Drug antagonism. When a patient is taking more than one medication could block the body's response to another medication. You can use this to your advantage. Summation effect. Two drugs that have the same or similar effect increase the patient's response when both are administered to the patient, an additive effect. Synergism is a patient receives two drugs that have the same effect but produce a response greater than the sum of their individual responses. Potentiation, the interaction between two medications, can cause one drug to enhance the effect of another. For example, when alcohol is ingested along with acetaminophen, more of the medication is taken up into the liver and may result in acute liver failure. Some potentiation effects are known and can be exploited to achieve a desired effect. In other cases, potentiation may occur unexpectedly. Interference is direct biochemical interaction that takes place between two drugs. Reducing medication errors. Medication decisions are often based on memory and frequently occur in the context of a stressful, life-threatening patient situation. Advanced EMTs are constantly at risk for a cognitive error, such as choosing the wrong medication or dose, or a technical error, such as administering more volume of medication than was intended. Use the 10 rights of medication administration: the right patient, right medication, right dose, right route, right time, right documentation and reporting, right assessment, right to refuse, right evaluation, and right patient education. Use a current reliable medication reference source whenever administering potentially unfamiliar medications. Technical errors can be avoided by having a partner confirm the volume in a syringe or a weight-based medication calculation. Evaluate a patient for medication allergy or hypersensitivity before each medication administration. The Institute for Safe Medication Practices has developed a list of medication abbreviations prone to causing errors. Table 1211 in your book lists several important sources of errors relevant to the pre-hospital setting. Specific medications. As an advanced EMT, you may administer oxygen, oral glucose, glucagon, IV dextrose, intravenous fluids, epinephrine, MDI medications such as albuterol, nebulized medications, again albuterol, nitroglycerin spray tablets or paste, nitrous oxide, naloxone, aspirin, or others based on local protocol. You may administer or help administer these medications only under the following conditions. A licensed physician gives you a direct order to administer a medication, and or the local medical protocols under which you are working permit you to administer that medication. The local medical protocols under which you are working include standing orders for the use of a medication in defined situations. All right, that's it for chapter 12.